The pivot shift test will test for ACL or an ACL tear. A positive test is subluxation of the tibia. The patient will be supine with legs relaxed. The examiner will be standing next to the treatment table. The examiner will grasp the heel of the involved leg and hand on the proximal tibia. Examiner applies pressure while rotating tibia as knee is moved into flexion. McMurray's test for a meniscus tear. The subject is supine. Examiner will be standing next to the treatment table with the distal hand grasping the subject's heel. Proximal hand is on the subject's joint line with the knee fully passively extended. Rotate the tibia, put a valgus force on the knee. Repeat with internally rotated and varus force. A positive test is if a thud or a click is felt along with pain. The bounce home test is to identify possible meniscal tension of knee. The patient is supine. Examiner stands next to table. Right hand will be on posterior proximal thigh. Left hand grasping foot. Patient flexes foot, then extends. Test is repeated multiple times. A positive test is lack of full extension. The reverse pivot shift tests for posterolateral rotation of knee. The subject will have knees flexed to 80 to 90 degrees. Practitioner will be next to table. With knees flexed at 80 to 90 degrees, a valgus and external rotation force will be applied to the knee. The knee is then extended. A positive test is if tibia would be subluxed, posterior or laterally. Clarkstein tests for roughness of the patella on femur. The patient will be supine. Practitioner will be standing next to treatment table. The web of hand will be above patella, applying downward pressure. The examiner will ask the patient to flex their quadriceps muscles. Positive test is retropatellar pain, or pain behind without ability to hold contraction. The posterior sag tests for PCL tears. The patient will be laying supine with knees at about 90 degrees. Examiner will be standing next to treatment table. Examiner passively brings knees to about 90 degrees of flexion and compares level of tibias. Positive test is posterior displacement of the tibial tuberosity is greater in involved leg. The vagus stress test tests for damage to medial collateral ligament of knee. The patient will lay supine with knees extended. Examiner will be standing next to table. The examiner will, with one hand, will be placed as a pivot on the knee, with other hand placed upon the foot, applying an abducting force. A positive test is if knee gaps on inner portion of the joint are greater than normal. For the varus stress test, this test tests for an LCL sprain. The subject is supine with knee in full extension. The practitioner will be standing next to table. Examiner places distal hand on the subject's lateral ankle and proximal hand on the knee. With ankle stabilized, apply a varus force at the knee with proximal hand. A positive test is pain or laxity. In the patella glide test, the patient will be supine. Practitioner will be standing next to table. This tests for patellar instability. The examiner places both thumbs on medial border of patella. Patient remains relaxed while the examiner gently pushes the patella laterally. A positive test is if patient is apprehensive to this movement. In the patellar grind test, the patient will be supine. Practitioner will be standing next to table. This test for patellofemoral chondromalacia. Examiner places web space of his hand just superior to patella while applying pressure. The patient will contract quadriceps muscles. A positive test is grinding or pain. For the posterior drawer test, patient will be lying supine with knees extended at 90 degrees. Practitioner will be sitting on the table. A positive test is backward movement of the tibia. This tests for ligaments in mobility and determine if there's any swelling. Examiner sits on foot, both hands behind the knee with thumbs on the joint line. Examiner pushes backwards on the knee. Hamstrings should be palpated frequently to ensure relaxation. Apley's compression test is to test the meniscus. Patient will lay prone with the affected knee flexed at 90 degrees. Practitioner will be standing next to affected knee. The tibia is compressed into the distal femur and rotated externally to evaluate the medial meniscus and internally to evaluate lateral meniscus. A positive test is pain. Apley's distraction test is to evaluate the meniscus. The patient will lay prone with testing knee flexed at 90 degrees. Examiner will be next to table. Examiner will grasp the lower leg and distract the tibia away from the femur while internally and externally rotating the tibia. A positive test is pain. The Lockman's test tests for ACL and PCL tear. The subject is supine with knees flexed at 20 to 30 degrees. Examiner will be sitting on treatment table. Examiner places distal hand on the tibia tuberosity and proximal hand on subject's distal thigh. Examiner applies an anterior force to the tibia with the distal hand while stabilizing the femur. Positive test is if tibia is soft or mushy. The subject will be supine, knees flexed at 80 to 90 degrees. Practitioner will be sitting on feet. Examiner will palpate joint line with both thumbs and will try to move tibia anteriorly in an explosive movement. A positive test is tibia moves forward more than 6 millimeters or soft/mushy feel. The test is to determine if there's an ACL tear.